In April, UCSF studied the impact of COVID-19 on low-income communities. Not surprisingly, those communities lack the testing of more affluent neighborhoods. As NBC Bay Area's Rosato Jr. shows us, a new study released today shows not much has changed.
The bustling transit hub of San Francisco's 24th and Mission. Hundreds of people winding through here each day. And according to a new study released today, many of them unknowingly carrying COVID-19. Throughout August, UCSF conducted COVID-19 testing twice a day outside the 24th Street BART station.
We barely advertise for this study. People are lined up.
9% of the 2,622 getting swabbed tested positive for COVID-19. 93% of those positive cases were from the Latinx community.
The majority of the PCR positive persons were from the Mission, Southeast San Francisco, and from San Mateo County.
The findings mirror a study UCSF conducted in the Mission District back in April. It found the people most impacted by the virus were low income, living in dense housing, working jobs that wouldn't allow them time off to isolate.
33% of monolingual Spanish-speaking folks do not have proper access to internet. That's a barrier. If folks don't have the luxury of owning a car, that's a barrier.
John Jacobo with the Latino Task Force says the study reveals a lack of testing in neighborhoods most impacted by the virus.
But the issue is that there's not enough access to testing. There's not enough resources to provide people to isolate and shelter in place. There's not enough contact tracing or case investigation.
In September, the testing will move to the Fruitvale district of East Oakland, another place likely to show how the disparity of care runs along the lines of income. Rosato Jr., NBC Bay Area News.